Hello, and thank you for joining us tonight for our free webinar, Chinese Medicine and Dermatological Conditions, featuring Dr. Martha Lucas. My name is Jeff Bloom, Education Marketing Manager here at L.A.C. OMS. For over 40 years, L.A.C. OMS has been striving to promote the growth of the acupuncture industry by providing quality products, great prices, and the best customer service, as well as supporting the many schools and continuing education efforts available. With our free webinar series, we intend to provide free educational opportunities taught by some of our industry's most renowned practitioners and educators. I would like to take a moment to acclimate you to the webinar room. To the right of the video screen, you'll see 3 tabs: Chat, Questions, and Polls. To chat with other attendees or to communicate any technical difficulties, please use the Chat tab. For questions of our guest speaker, please make sure to use the Questions tab to assure that we see them during the questions and answers time, which will be at the end of the lecture. And then please note that each webinar is recorded, and immediately following the conclusion, you will all receive an email with a link to view the video on demand and a copy of the slides. You may always visit our blog and use the free webinar tag to find all of our previously recorded events. From neuroscience to sports acupuncture to Chinese herbs, you'll find something interesting for every practitioner on the L.A.C. OMS blog. Now for our featured speaker. We are proud to introduce Dr. Martha Lucas. She is a teacher, author, and practitioner, and is uniquely qualified in the field of Chinese medicine because she holds a PhD in research psychology as well as certification and licensing to practice traditional Chinese medicine. She is internationally known for teaching and training practitioners in the Meizen cosmetic acupuncture system and pulse diagnosis feedback and balancing. She also teaches practitioners how to properly take care of their patient's skin using the product line that she developed called Meizen Skincare. Her private practice is based in Denver and Littleton, Colorado, where she specializes in internal medicine, diagnosis and treatment of serious chronic illness, and of course, Meizen cosmetic acupuncture. Please join me in welcoming Dr. Martha Lucas.
All right. Hi, glad to be here. So the skin is an interesting thing to talk about because when you're trying to educate your patients about their skin, a lot of people just don't think about it as an organ, right? We call it even an organ system because it does a lot. It does more than just, it's more than just like a big bag where all of our organs stay in. It actually has a lot of functions. But I find that people don't really start to think about their skin until something goes wrong with it. They really take it for granted. The fact that it's monitoring our temperature, it is protecting our body from germs. It's, basically functioning always 24 hours a day, every day, until they either get a rash or some acne or sometimes wrinkles. And then they decide, yep, it's time to start taking care of my skin. So we're going to talk about the skin tonight. We're going to talk about pulse diagnosis and kind of the way I have for the last more than 2 decades found and treated skin kinds of issues. So let's first talk about pretty much one of the most common skin conditions out there, and that would be acne. Now, acne is thought to be caused by multiple factors. Sometimes it's overproduction of normal oil on the skin. And it's interesting that lots of times that's why so many people with acne scrub and scrub and scrub and scrub. And really, lots of times treating it with an oil cleanser actually helps more than drying it out more and more. But people know that there can be this overproduction of oil or sebum, and then they tend to just dry out their skin too much. And also we know that it is caused by hormones. Like, how many women only get acne once a month and only here? Okay, that's hormonal acne, right? They only get it at a certain time during their menstrual cycle. Plus, let's say you never exfoliate, which means scrubbing the dead skin cells off. Well, then your hair follicles can get all stagnated, and that can lead to acne. It is an infectious disease. It's one of the most prevalent human diseases, and it can be seen in any sex, so male or female, any sex. And oftentimes in adolescence is when it really does start. So there are some people who have severe inflammatory acne. Most of the time, it's kind of a mild case, but it's most distressing probably for most people when it's on their face. It can be on the upper back. It can be on the chest of some people. It can be in a place where there are more oil glands. And as I said, it's very prominent. It can affect up to 85% of teenagers. I'm telling you that 2 million visits to physicians a year are for teenagers that are suffering from acne. And there's a lot of money spent on not only doctors' visits, but also the acne treatments. Now, not only is there the physical part of acne, but there are psychological issues with it, psychological, social, and emotional impairment, because you want to have beautiful skin. You think you're not making a good presentation when you have bad acne. So very, especially in adolescence, when children start to get acne, they can get very psychologically upset about it. In fact, some studies suggest that acne causes as much psychological distress as conditions like diabetes, arthritis, and epilepsy and asthma. It's estimated that it affects about 650 million people globally. It's the 8th most common disease in the world. And most people do believe that it starts in adolescence and it does usually go away with age. Now, this is where some facial diagnosis would come in. If someone older than an adolescent comes in and they say to you, someone's 50, and they say, I've never had acne in my life, but all of a sudden I am having some acne. Well, then you would look at where it is on the face, right? If it's up on the forehead, it can be stress related, or it can be digestive related. And then we look at the other parts of the face, right? Here we know it's mostly hormonal acne. Maybe the kidneys are involved. On the cheeks, maybe it's the lungs, or look at what channel it's on. If we see it on certain channels, then we can make a decision on maybe what's causing that acne that someone gets as an adult that did not have acne previously. Then there's also something called Picker's acne. Now, this can result in scabs and scars. Acne vulgaris also can be scarring acne, but especially if the person is picking at it, scratching at it, this is liable to lead to more scars and scabbing. So it is a good idea not to possibly, if you're adolescent or young adult, can keep their fingers off their face and stop scratching it. It will reduce the possibility of scarring. Also, there are keloids, right? There are a skin condition where it's inflamed bumps and scars. Lots of times it's on the back of the neck. It is, it's related to common acne, but this is much more of an inflammatory situation. The follicles are more involved than just your standard acne. And then we have solar keratosis. So this is rough, scaly skin that is due to sun exposure. So with acne, what I'd like to show you is where you would find it in the pulses. So this section here, stomach, spleen, large intestine, lung. Remember, we talk about that running, we talk about the lungs running the skin, right? So in these sectors here, very often is where I'm going to see an imbalance. Let's say that the person, they're from an old age, they're very low in the spleen and the stomach are very deficient, or it's blocked here going into the lung, large intestine. Well, the immune system, which runs the skin, is having a problem there. So when you feel things like that in the pulses, so you feel that the lung and the large intestine are not communicating very well with the spleen stomach, so earth and metal are not communicating very well, then I always ask the question, are you having any skin problems? So I make it a little bit of a bigger picture. I don't just say acne. I say, are you having any skin issues? Acne, rashes, hives, because I just don't mind telling people, if your earth and your metal are not communicating, so there's not a nice flow of energy like this, yang and yin, yang and yin, yang and yin, then certainly you are going to eventually have some skin problems. Oh, and hair too. I'll ask, do you have any skin problems, hair problems, anything like that? And this is something you don't even really have to know about them. You can just ask because you can feel it in the pulses. Number one, their immune system is not functioning perfectly well. And the lung, large intestine that we say in Chinese medicine runs the skin is not getting adequate support from the organ system before it. So this is one of the first things I do is look at the pulses and see if I can figure out that the lung and large intestine are not getting the proper support that they would normally get. So that's a pulse. Now, I want to show you also, if I could just share my screen for a minute, Jeff, I want to show some before and after acne pictures.
Alrighty, so if you go to the little box at the bottom that says share with the arrow facing up.
I see it.
Perfect. And then we'll do share, you can do share screen.
Okay. Okay.
And then perfect. Okay.
Okay. So this is a before and after acne picture. Now, as you can see, this young woman had scarring acne. So here's a before picture. Here's an after picture. Here's a before picture. Here's an after picture. So her skin got beautiful, beautiful results from treatment. Okay, we can unshare.
Okay, let's take that down. And then, do you want the slides back up?
Yes.
All right, and I'm going to get off screen.
Okay, so how I treated that young woman was, and this is how I treat a lot of acne patients, I treat them with Meizen cosmetic acupuncture because that technique is designed to treat the dermis. It's designed to reinvigorate the dermis. And guess what? We can not only reinvigorate the dermis for lines and wrinkles and sagging to give people a little facelift, but think about it. If I reinvigorate your dermis, then I am going to help take away things like acne. I'm going to make your whole skin work better, not just for lines and wrinkles. So even though she's a younger woman, so not somebody who would be coming for Meizen cosmetic acupuncture for wrinkles, she was coming for acne. So I did the treatment like I usually do, 2 times a week for 5 weeks. And then I went down to once a week. And once we got that beautiful smooth skin, plus I was using products. I was using an astragalus product. I have a wakame stem cell eye cream that I mix with some banlan gun and dangwei powder, and I have the person put that on their skin, especially if they have a breakout. Now, something to get results like that, you want to maintain results like that with scarring acne like that. So you do need maintenance treatment, but that is one of the best ways I have found to treat especially scarring acne. And believe me, when you can take a young person's face or even older that is so used to that redness and pocked look and make their skin look really, really beautiful, they love you. So that is one way that's the main way that I treat asthma. Now, know that I take pulses every time. I take them a number of times during the treatment. So I'm also doing body points. I never just do Meizen cosmetic acupuncture or any treatment just on that one area. I always take the pulses. I always try to feel, how are the lung and large intestine doing? Are they communicating with the earth? Is that one of the issues that's causing the acne? So I never just treat like I'm going to just do this acne treatment alone. I always, always, always take the pulses and treat the cause, right? Because that's our goal in Chinese medicine. We don't just treat symptoms, we treat the cause. So allergic dermatitis. So this is usually some sort of hypersensitivity reaction to something, some sort of allergen. It usually happens 48 to 72 hours after exposure. And so this would be, the person says, oh my gosh, I suddenly got this rash. What's going on? Okay, again, I always look at that relationship between earth and metal, see if there's a problem there, because, you know, if their body was working perfectly, number one, they wouldn't have allergies. And number two, they wouldn't have a contact dermatitis. So there's probably something going on in that world of pulse diagnosis. So, and again, you're not only looking at those two sectors, but that's where you're going to find a lot of issues with those two sectors of the pulses when you're looking at skin issues. So alopecia areata, okay, this is an autoimmune condition that results in hair loss. Now, again, as I pointed out earlier when I showed you that pulse picture, autoimmune, we're going to be looking at, again, earth and metal, because that's the immune system, right? So I'm going to look there. And what happens is this hair loss can come in patches. It can be only on the scalp. It can be all over the body. So again, it's, you know, sometimes it does grow back in about 12 months, but in the meantime, it's very upsetting when somebody starts to get patches of hair that just fall out, or they go completely bald. It's very, very upsetting. So researchers do feel like it's an autoimmune reaction. And that means, what autoimmune means is that the body's immune system is incorrectly attacking the own body. Okay, so in this case, the cells under attack are the hair follicles. So again, most of the time in the scalp, but there are some people who get bald spots in other parts of the body. We do feel like genetic factors play probably a big role. Especially if people are under 30 and they get it. About 40% of people younger than age 30 have at least one other family member that also has alopecia. About 60% of people that experience it, the first episode before the age of 20, again, usually it's some sort of there's a genetic component. And again, lots of times the hair does come back, but if we can help them grow it back faster, that is really good. In more than 90% of the cases, it does grow back and the bald spot fills in within a year without treatment. However, reoccurrences are very common. So here again, we can be with Chinese medicine. The person comes in, we help their hair grow back in faster, and then maybe we can prevent reoccurrence of the condition. It seems to be that the risk of developing alopecia areata is unusually high in people who have asthma. You know, there we go, an autoimmune condition, hay fever, again, autoimmune, thyroid disease. So you can see there's a pattern here that it very often is paired with some other autoimmune condition. Now, it used to be that we thought, well, you know, episodes can be caused by stress. Current research is not showing that. They're really, really going toward the thing that it's an autoimmune condition or genetic. And again, there's no permanent cure for it, they say, although I feel like we as Chinese, at least I as a Chinese medicine practitioner, do feel like I use the cure, word cure, a little bit more than Western medicine, because if I can get the body functioning right, if I can get everything balanced and all the organ systems communicating with each other, then the condition can go away. So my goal with something like this condition is get the immune system back in order so that I can prevent reoccurrences, help the hair grow back in. You know, I would really like it if I could keep my patients off corticosteroids. They are drugs like prednisone are indeed miracle drugs for some short-term issues, but we do not want to have patients be on them for very long. I am, if somebody needs a burst of it, that's fine, but we certainly don't want them to be on it for a very long term. So in this case, we're looking at the autoimmune, right? So you might, again, I'm going to show another picture here. So this is just a bigger picture of the pulses. So as I said, I tend to look here for the immune system mostly, but the whole system is part of it, right? So we have, and this infinity symbol is just that, this is how the left side comes over through the kidneys, supports the right side comes back over through the kidneys and supports the left side. So I'm not suggesting that you only look here and only treat here. You're going to have to treat all of the sectors, but any sort of deficiency in here or back and forth in here, movement where these are not communicating very well, can give you the diagnosis that it's an autoimmune condition. And of course, since the kidneys fund everything, right? The kidneys fund everything, then we're obviously going to be looking at the kidneys too. But for autoimmune, I wish I could say, oh, here's a prescription for that. But I don't work with prescriptions. I work with the pulses. But I'm telling you that for autoimmune conditions, look at the earth again, the earth and the metal, to see what's going on with the person's immune system. Okay, we can have slides again, Jeff. There we go. So here's an interesting new condition, COVID toes and chilblains. Now, these are painful swollen bumps. Some people call them blistering skin lesions that appear on exposed skin on fingers, nose, toes, and the soles of the feet in cold, damp weather. Now, a rash named or nicknamed COVID toes has been seen in people who have been diagnosed with COVID. There's some swelling. It's usually triggered by cold exposure. Unfortunately, like a lot of the things with COVID-19 right now, the pathogenesis of it is not entirely understood, but they do think there's some sort of vasospasm and some type 1 interferon, again, immune response. So here we go again with something that's happening on the skin that is also involved with an immune response. So this has been seen more in COVID-19. I don't think there's a direct causality yet. They're not willing to say, oh, yes, this is absolutely caused by COVID-19. But when you get a certain number of correlations, this thing happens and this thing happens, then eventually you're maybe going to work toward being able to say at least that COVID-19 is a probable cause of a person experiencing this, this condition. And as we all know, when people get the severe respiratory syndrome of COVID, it does trigger an immune response. Type 1 interferon is involved, and then people can get these what are called COVID toes. Now, one of the things that is going to be asked is we're going to be now talking about the question whether the SARS-CoV-2 triggers a some sort of lymph inflammatory response at these particular sites. In other words, why doesn't the person get these blisters all over their bodies? Why is it only at these particular sites? And it is unusual that most of the reported cases of this have occurred in younger patients with no history of it and in warmer weather. So again, it's initially we thought it's caused by cold, but like a lot of things COVID-19, now we have seen this happen in warmer climates, or in warmer conditions. There are a lot of hypotheses about it, but again, there does seem to be an interferon communication, an interferon, dependence on it. And so what they're going to have to start doing is looking at how interdependent all of those mechanisms are with each other. And we need to see, as the pandemic not as it disappears, when the pandemic disappears, do we still have this kind of condition happen? Because then they're going to have to look at, they're going to have to look at other viruses and see what other combinations start this kind of a condition. Plus, there are some people who have lupus who have it. So we're also looking at that possibility. So this is another, again, this is something that is seems to be associated with SARS-CoV-2. So we're going to have to look at it in the future to see if it goes away once the pandemic goes away or not. Now, in terms of Chinese medicine, again, we're going to have an immune system response, right? Like also if it's seen in people who have lupus, that's an autoimmune condition. The skin loves, and when you think about it being our largest organ, it makes a lot of sense that the skin is highly affected by what's going on in the immune system. So with this particular condition, you're maybe not only dealing with the skin eruptions, but you're also maybe dealing with upper respiratory symptoms as well. It doesn't seem to be people who are asymptomatic with COVID do not show up with COVID toes. So it's more with the people who end up having a more severe case of it. So what are we looking at again? We're looking at earth and metal. We're looking at large intestine, lung, stomach, and spleen. And, some people might say, well, what about the heat? Okay, there's a lot of heat involved in these sorts of eruptions. It's true, there are. So you're probably going to be doing a lot of acupuncture points that remove toxic heat, or you're going to use herbs that remove toxic heat. But my thing that I like to focus on is always, always, always remember the immune system component. So I do not believe, and it's not been my experience, that you can just drain heat, drain heat, drain heat. You need to rebuild the person's immune system through the earth and the metal, as well as combine it with some heat resolving points or heat resolving herbs, which we can do, right? If you're taking heat out of the lung, large intestine and balancing it, if you're reducing the yang to build up the yin, and you get that sine wave going that I talk about all the time with the pulses, then you're doing a good job of reducing the heat. Remember, acupuncture doesn't take anything out or put anything in. All we're doing is taking, for example, an out of balance picture like this, what I showed you before, out of balance, and we're going to take this out of balance information and put it over where it's needed in other places. So you're on the right track, even if you're doing heat resolving points, to just like maybe they need that heat in the lower dantian. So you learn how to take that heat, move it so that it's helping other parts of the body. Okay, so eczema. Oh my goodness. Eczema is a disorder, as you know, that is very dry skin. It's got intense itching. Patients love to or feel like they have to scratch it. And again, the exact cause of it is unknown, and there is no known cure. I love treating these kinds of conditions where they say there's no exact cause and there is no known cure, because I think of all the times that we can help patients in that situation with Chinese medicine. So with eczema, it's usually chronic. It's very inflammatory. It does happen, they say, more frequently in children. I have not seen that in my practice. I've seen more adults with eczema than children, but it could just be who's coming to see me. And it's a relapsing thing. So they usually do some sort of therapy and it comes back. Lots of times it's some sort of topical therapy. That's the mainstay of eczema treatment. Phototherapy they can use, but again, that's still more or less topical. And it seems that the issue is there's a dysfunctional epidermal barrier. So even the topical moisturizers very often do not get down into where the condition is being caused. So it's lots of patients go through trying this, trying that. They seem to have to be trying a ton of different things that are not working for them, because what has to be dealt with? The dermis has to be dealt with. So they try to do things that lubricate the skin, hydrate the skin. Some people feel like putting a little heavier occluding thing on, like mineral oil, helps them better. Studies do show that these hydrating creams do lessen the symptoms and lessen the signs of eczema, but it's kind of like the underlying inflammation is still there. So that's what really, really needs to be dealt with. There are all kinds of treatments people do. They do different kinds of baths. They take cold baths. They put moisturizers in their baths. Right now, they have things called prescription emollient devices, which is a newer class of topical agents that they're using, looking at that epidural layer that they feel like is malfunctioning. And generally speaking, people need to put these topical creams on, pretty often, at least 2 or 3 times a day. Some people have a very hard time even with showering and bathing, because while you would think I'm putting water on my skin so it's going to hydrate the skin, it really doesn't. What they need to do is not towel and stand there and try to allow the water to go in. But, again, they may have they just took a hot shower, so they kind of put inflammation on inflammation. It's a very, very kind of difficult condition to treat. Lots of ideas about using non-soap cleansers, be hypoallergenic, be fragrance-free. Look at the pH in your soaps and any topicals that you put on. There's something called wet wrap therapy, which this would be used for someone with very, very severe eczema, where you put the topical agent on and you put tubular bandages on, or gauze, or even a cotton suit, and then you have layers. Like we do this, those of us who practice doing paper masks on people, I do something called a moisture bomb. And really what it is this. I put on a few different products and a thick cream, and then put the paper mask on, and it's the same idea. I mean, part of the idea is I'll tell my patients who are coming for that, I just covered up the moisturizer. It doesn't have anywhere to go because there's a cover there. So where is it going to go? It has to go into your skin, which is the same idea with this wet wrap therapy. I put the moisturizer on, I wrap it, it can't get out. It can't get out because I have it covered, so it has to go into the skin. And sometimes people have to wear these wet wraps for like 24 hours. So it's eczema. For those of you who have treated anybody with eczema, it's a very, very tough thing. Lots of times they're going to end up using topical corticosteroids. Again, they'll thin your skin. The skin is an organ. What you put on the skin is going to go in your body. So you really don't want to have to use something like that over and over for a very long time. And obviously with those sorts of drugs, you have to always look at the side effects. So, the thing with eczema is judicious treatment. I think a lot of people, why their eczema, they think it's gone away and it recurs and then it comes back and it comes back worse, is because they weren't judicious with their treatment. So even with Chinese medicine, people have to be judicious with the treatment. It's not going to be a one-time, oh, here, I mean, we do have some great topicals out there. There's no doubt about that. But I still think you need to deal with the underlying inflammation, right? I mean, if the herbal cream you're using actually does deal with the inflammation below, that's all great. But if it doesn't, then obviously you need to use your acupuncture and herbal treatments to deal with the underlying cause, because that's how we're going to make it go away. Although I will say, in the state where I live, we can do ozone therapy. And I recently did a case where I might have posted on the Lucas Teachings Facebook page. I did what's called bagging. This gentleman had just his forearms were covered, and right above his elbow were covered with, it wasn't eczema, but it wasn't a dermatitis because it was more chronic than that, but they were almost blue lesions. He said it itched. He wanted to scratch it like crazy. And so I did for 5 days in a row. I bagged those arms, put ozone in there for 30 minutes, and wow, what a huge result. Ozone therapy for topical skin conditions is a completely safe. Ozone is just activated oxygen, right? So it's high activated oxygen. It's oxygen, it's O2 with another oxygen molecule. So that's why I call it highly activated oxygen. And if you can do that, or in your state, you can't figure this out, you can't figure out this skin condition, and you don't know what to do with it, and the person, you've tried everything and the person hasn't gotten any results, then I can very, very highly recommend that they go and get what's called ozone bagging. And it is intense. It's, like 5 days in a row, 3 to 5 days. I do the 5 days because I want to really make the thing go away. And it's very, 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 very healing. So, it's no doubt that eczema is tough. I think when you are dealing with eczema patients, you have a whole bunch of things going on. You have, of course, the skin issue, trying to figure out the cause of it, looking at what they've already done, because you don't want to repeat what they've already done. So you're looking at the cause of it. You're trying to take the inflammation on the skin down, either topically or using acupuncture points. And there's a very, very big psychological component, I find, with it, because it's so itchy and it can just be so scaly and ugly looking. And so you also have to deal with the person not getting too discouraged or not flat out getting depression. So again, with a lot of these other skin conditions, we're always looking at the same thing. We're looking at the earth, we're looking at the metal. We need to make sure that the kidneys are supporting those organ systems. And we need to be trying to figure out what's the trigger, what's the cause in this person. Do they need to make some lifestyle changes? And again, as I said, I can't stress enough that they have to be judicious with their treatment. This is not one of those, oh, see you in 2 weeks kinds of treatments. But again, a lot of people are very motivated when they have something like eczema. So seborrhea, there I am. So it's not contagious. Oh, by the way, let me go back for a minute. Well, more than a minute. Let me go back and say something about acne and its infectiousness part, because there's a problem. We don't want to do something like derma rolling if someone has an active outbreak of acne, because there are it can be infectious material in there. And if there's one thing you don't want to do, it is take something like a derma roller that's going into bacteria and roll the bacteria into the rest of the skin. Okay, so just be very careful with that. I have some patients who want, they're like, well, can't I just do derma rolling? And I'm like, well, not if you're having an active outbreak, because if you're having your outbreak here, you do not want to derma roll that to the rest of your skin. So just an FYI about that. It can be a great technique for certain things, but not when someone's having an active infection of anything on their skin. Okay, so seborrhea. This is non-contagious. That's what made me think about talking about not spreading your acne around your face with a derma roller. And again, it's mostly on skin areas like the face, the scalp, the upper trunk that have a lot of oil glands there. And it's basically the overproduction of skin cells. And, it can be redness and inflammation, of course. Obviously, it can be real mild, like a little bit of dandruff, to really, really bad red patches on the skin. Interestingly enough, it can accompany psychiatric conditions like Parkinson's disease and depression. It can accompany a weakened immune system. So, be looking at that. Sometimes it will accompany things like HIV, alcoholic pancreatitis, If the person is recovering from a stressful medical condition like a heart attack, sometimes they have an outbreak. Some medications, the usual treatment is medicated shampoos, creams and lotions that control inflammation. There are, of course, prescription corticosteroids that are effective, but use them sparingly. If you use them for weeks or months without a break, then you're going to have side effects like the skin thinning, or actually it'll start to show streaks or lines in it. Sometimes they try antifungal gels, antifungal creams. So again, in Chinese medicine with this, what we're looking at is what controls the skin, lung, large intestine. Looking at the history of it a little bit, did the person just have a stressful life event? Then maybe we need to look at liver, gallbladder. Maybe, remember, the left side works with the right side, like I showed you with the infinity symbol from left to right. So even though I'm over here thinking lung, large intestine because it's the skin, I may need to look over here at what's going on in the gallbladder, liver. What about the small intestine and heart? Are they having some heart fire? Okay, the key word there might be fire. So always looking at all of the organ systems, as many as you can, but also always thinking about lung, large intestine, earth, and metal. Okay, so lupus. All right, lupus is a disease, and again, it's when your immune system, it's an autoimmune disease where your immune system is attacking its own body. So lupus is fascinating because it can show itself in a lot of different ways, right? Some people do get the skin condition, right? They get what is called a butterfly rash. And some people get joint pain because it's an inflammatory, it inflames your connective tissue. I just have learned, because one of my daughters is in the hospital right now and they're thinking maybe she has lupus nephritis. And apparently lupus can let your skin alone, let your face alone, let some of your other organs alone, but it's going to just go to your kidneys. So it's a very, very interesting disease to treat because, again, focus on the immune system. The person's immune system is not working correctly. Now, why? Well, we don't know why. So we, as Chinese medicine practitioners, we can go back and we can look at, for example, the spleen and the stomach. Here I go with another picture, Jeff. Let me just draw it for you. If I have such deficiency in the spleen and stomach, I draw it going down like that the lung, large intestine is not getting any support at all. The beauty is this doesn't have to stay like this forever, right? I can take things over here. If the heart and small intestine are all stagnated because the person is very upset about their condition, well, I can move this around. Like I said, I can move it around like the infinity symbol. That's how we make things be balanced and help the person. So, with my daughter, the last time she had what they thought was a lupus outbreak, finally her doctor today, her hematologist, after 14 years said, oh, it's probably lupus. Well, I've been treating her for those 14 years. But this is a flare up as the result of something. So now we'll know never to do that again. But at any rate, we can go back to the slide, Jeff. Lupus is very complicated. It can be, just show itself in a whole bunch of different ways. Right now, they have treatments for it, but it's drugs like, obviously it can be corticosteroids. They can give people infusions of rituximab, mycophenolate. Those drugs have some pretty bad side effects. So again, how I treated it was got my daughter's immune system working again right. So she was able to get off her mycophenolate for years. And then, as you see things come up that are looking like a flare, then you need to treat that. But in terms of when someone comes to you and just are concerned about their butterfly rash, you're going to have to treat the system. You're not going to make much progress just treating the rash. So you're going to have to look at the whole system. It's an autoimmune disease, so you're just going to have to look at treating their whole immune system. And then hives. This is itchy red bumps. I had a patient. I have a favorite treatment for hives. It's actually my kind of allergy. Maybe you're having a little dermatitis. Anyway, it's Li4, Li11, spleen 10, stomach 36. So I do the pulses, I balance everything out, and then I add those 4 points in, Li4, Li11, spleen 10, stomach 36. And I had a person who had what I called anniversary hives because she got them every other January. It was almost to the day. They would start in the middle of January, start as a little bit of hives, and then move on to where she would wake up in the morning and literally, like, I could see pictures, have like a square face. Everything was so swollen. And so, before she was introduced to Chinese medicine, she tried all of those things that you see up on the screen. Antihistamines, corticosteroids, antibiotics, just everything to try to fight that inflammation. She always ended up with the steroids last. But what would happen is they would get resolved for like 2 or 3 days and then come back. Well, why? Because the cause wasn't being dealt with, right? So what I did was I saw her one of the years during the anniversary, so during the year. And every single time I saw her, I added those 4 points. And it's so interesting that she came every week and she had to skip a week. She had to go, her dad was, she needed to go see her father. And that week she skipped, she had the hives. It was just fascinating that acupuncture managed to keep her body, from expressing those hives, and that 1 week she missed, they came out. So they usually lasted for about 6 months. And then what I did was, in an off year, I said, okay, you can't stop treatment. We have to keep doing the treatment in the off year to see if they won't come back on the anniversary year. And we had to do that once. We did the off year once, they didn't come back, and they have never come back since then. So again, it was the combination of treating her immune system and, maybe there's some magic in Li4, Li11, spleen 10, stomach 36, not alone with pulse balancing, but anyway. And then melasma. Okay, here's another thing that is very hard to treat. I have, and it's mostly hormonal. A lot of women get it during and or after pregnancy. You do not, if you have it, you do not want to be out in the sun. By the way, the number one cause of wrinkles is the sun. So you want to protect yourself from it. But the first thing you need to do is probably confirm it with a dermatologist that it is actually melasma. And then you look at how you're going to treat it, because we want to address the underlying cause. Now, let me go back to melasma. It's interesting that the most success I have had treating melasma is using Mazen cosmetic acupuncture. In fact, I've known my dermatologist for years, and when I showed her that, because the patient also happened to be a patient of hers, she said, and remember this for those of you who like to treat melasma, I will send every one of my melasma patients to you because I can't do anything for it. That's a pretty stunning thing for a medical doctor to say. I will send you all my melasma patients because I can't do anything about it. So, like, I work 2 days a week in an internal medicine clinic, and those are the patients I get. They'll be like, these migraines, we've had the person on their meds for years and we're not doing anything. We can't do anything. Or back pain, we can't do anything more about that. So here's this patient for you. So my wish comes true that I get complicated patients, because that's who they send me in that internal medicine clinic. So with melasma, again, I feel like what the Mazen cosmetic acupuncture did was it's very focused on the dermis, it's acupuncture points and acupuncture channels. And so what it did was reinvigorate the dermis of these melasma patients to stop doing that, to stop spreading the discoloration. So, and again, always with body points, never just on its own. And then last but not least, psoriasis. Psoriasis, they call it a lifelong skin condition. Again, I think with Chinese medicine, okay, the person may have that diagnosis for their life, but they don't have to suffer with the condition for life. So what we're trying to do is stop the skin cells from overgrowing and try to remove the scaliness of it. Again, in Western medicine, they use a lot of topicals for this. There's that word corticosteroids again, because they work very, very nicely in the short term, taking the inflammation down, but they are not going to treat the cause of it. So, I will say that for some of these conditions, you might have to experiment a little bit. You might have to do some pulse diagnosis, look at how their immune system is doing, see maybe where the cause of the inflammation is, which organ system is the inflammation coming from, treat that, get them on some topicals, maybe use some herbal formulas, but lots of times it's a process. If this is a lifelong condition, then maybe the person is going to have to be seeing you for quite a while. Maybe they're not going to get over it in just, whatever we call one course of treatment. And remember, chronic conditions need more treatment than something that's a little more acute. So there you go. I know I talked on and on and on about the immune system, but that's because of that relationship between earth and metal. If the earth is not functioning well, like for example, if someone says to me, I just admitted to a new patient yesterday that, I did read your chart, believe me, but I'm going to ask you some questions when I'm taking your pulses that are going to make it sound like I didn't read it, but I did because I want to clarify. And when I ask people, how's your digestion? Because I can feel that earth is not supporting metal, is not supporting the lung, large intestine. So I first ask, how's your digestion? And then I ask, do you have any rashes, acne, hair issues? This woman told me her hair is falling out. And I knew that because the earth was not supporting the metal. But also when people tell me, I can feel their digestion. We can all feel when somebody's digestion isn't working well. And they say, oh yeah, my digestion works great as long as I don't eat dairy or something, and something. And I'm like, no, not so much. If you have to say, yeah, my digestion worked great as long as I don't eat, then you either have an immune system problem or your digestion doesn't work great. So at any rate, I will be happy to answer some questions if you have some. Jeff, you're the moderator for that, right?
Yep, I am right here, and we do have a bunch of questions, so let's get right into it. Thank you so much, by the way. That was awesome.
You're welcome.
First question, how about acne on the forehead only on a 10-year-old girl who has been treated by her PCP with steroid and now antibiotic gel, but nothing has helped to resolve? Do you have any advice?
Okay, on the forehead is usually either digestion, specifically intestines, or stress. So I know she's only 10, but I would have to look at, trying to talk to the parents about how much stress, but digestion, intestines especially, or stress. Or, yeah, that's the diagnosis part of what organ systems would be involved. If you were going to use some topical stuff, you could try something like what I mentioned, the stem cell cream with the little powder, because she could make a little poultice of it in your hand. She could leave that on overnight. So lots of times that inflammation will go down if the person can leave it on for a long, long time.
And Martha, that was the Wakame stem cell
Yeah,
eye
Wakame
cream.
stem cell. Yeah, they
Okay,
can buy it from Lhasa or at myzenskincare.com.
perfect. I'm going to put a link in the chat for everybody. I already did earlier, but just in
Okay.
case. And then did you say something like you added dongui to it?
I make a special powder. So I put some Banlan gun and Dongui in and a couple other things that I'm mixing antibiotic with skin tonifiers, and then I put the powder in the cream and make a little poultice and then dab it on like that.
All right. Next question regarding skin picking. Do you have any advice for working with patients who have body-focused repetitive behavior or OCD related behavior that involves skin picking, something more severe than just a bad habit?
Okay, so there you're talking about a spirit imbalance, right? The person has got some sort of um, spirit issue that is allowing them to hurt themselves instead of nurture themselves. So I would look at Earth. I'd see how their Earth is doing, because our Earth is our way to nurture ourselves, right? So in this drawing, let me get this out again. Where is it? Okay, so right here where I showed you the Earth is down like that, I drew a down arrow. That can be old childhood issues around nurturing. So I would look there first. And then, you know what? I think it's important to treat the pericardium. Sometimes with someone like that, it's more important to treat the pericardium before we treat the heart directly. So I love to do pericardium 3 and then some heart points like heart 5, heart 7, because I feel like if I open the pericardium first, it'll give the spirit the opportunity to be open. Whereas if I only did heart 5, heart 7, if the pericardium is pretty closed because the person can't nurture themselves, then you're kind of spinning your wheels a little bit working with the heart. So I would look at that.
Thank you. Next question. Dr. Lucas, I've done your Mayzen course and did not get results with facial acne. The inflammation worsened, so I backed off after 2 treatments. Is that indicative of something else going on with the client?
Well, sure. I mean, now you only did 2 treatments. Okay. Sometimes we have to persist. Sometimes I don't know the whole situation, and maybe the patient was like, don't touch me again. But you always have to look at what your body points are. So when someone says, I've taken Mayzen and I didn't get the results that I wanted, if you were to ask me that in an email, I would have you send me the body points you were doing, what your pulse diagnosis was like, and I would look at that and help you with that, because it should work. So, maybe whoever it is, if you've taken my class, you can have access to my contact, or on the Facebook page, ask a question. Because if the inflammation gets worse where you're needling, then there's definitely something in the other part of the treatment that you need to be doing, or herbally.
All right. Next question. I have 2 recent clients who are having hives and itchy skin since getting a Moderna vaccine. One was 3 days after her first visit. The other was 2 weeks after getting her second injection. Do you have any thoughts?
Yeah, I do have some thoughts. It sounds like a little bit of an autoimmune response. So their body is, attacking their skin a little bit because they don't like, maybe my guess always is they don't like the protein that was in the vaccine. So I would right away start treating their immune system. And I'm telling you, add in that Li4, Li11, spleen 10, stomach 36, because I've just had such good luck with skin outbreaks like that. But yeah, when somebody has a reaction, they had hives, but it's almost in the same category as something like the dermatitis, right? They had something happen to them and their body responded. So I would look at their building up their immune system, obviously taking some heat out, but back to the immune, because something happened to them and their immune system right away tried to get the toxin out through their skin. Because remember, our body gets out our toxins with urine and bowel movements, right? And if those aren't working right and the kidneys are a little overstressed, which happens in autoimmune conditions, their next way to get toxins out or something that they're rejecting is through the skin. So it sounds like that's what happened with your patients.
Next question. Has your practice seen an uptick in skin conditions due to the heavy wildfire season in Colorado during 2020? And did it seem acute or chronic?
I did not see that. That's a really good question that you would think maybe I would see that. I didn't see it. If I saw, honestly, I saw more lung stuff just because the breathing in the toxins. I mean, even in Denver where we had no fires, you could literally smell like rubber burning. So I didn't see a lot of skin things, but that does make sense that I maybe would have.
Next question about Meizen. So did the Meizen acupuncture alone work on the melasma, or did you also apply herbs too?
No, I just did Meizen with that. Body points to address the constitution, and then just the Meizen. But sometimes you need herbs. In some of the cases, probably I have put some people on herbs, maybe something to manage their hormones. But some people do really well just without any herbs. And remember, you do have some people that just aren't going to take herbs.
Next question is about the pulse. How do you do pulse balancing?
Well, I feel the pulse. My goal in every pulse, I'll show you a picture. My goal is to get the pulses to feel like this. Yang and yin, yang and yin, yang and yin across in here. So that means to me that all the organs are communicating with each other. They have yang and they have yin, and on both sides. So how I do it is I usually draw an imbalance picture. So I always draw the imbalance picture, at least on the first visit, because I keep notes of the points that I did, and then I can look back 3 treatments later. Like a good example is the daimai. An easy example is first time the person comes in, their daimai is blocked. So I do gallbladder 41, Sanjiao 5 to unblock it. I know I did that first. If on the 4th treatment I'm still doing that, I ask myself, why? What's going on with this patient that their daimai won't stay open? So I balance the pulses by step method. Take away blocks, then take away deal with excesses. And then last step would be add some tonification in. And all my new patients ask me, how many needles was that? And I'm like, well, let me see. I think I'm at like 25, and they don't care. They all say they don't care, but I'm fanatical about getting the pulses balanced. So if I have to put in a few more needles, I put in. And then at the end, like the Li4, Li11, spleen 10, stomach 36, I would add that at the end for something like hives. So that's 8 more needles. I already put in a whole bunch and I add 8 more. So it's a matter of feel the pulse, put in some needles, feel the pulse, put in some needles. And it's like research, right? I'm a research scientist. I get to see, did gallbladder 41 Sanjiao 5 work? Sometimes it does not. We hear over and over in school, oh, that'll unblock the daimai, but sometimes it doesn't. But you don't know that unless you can feel it in the pulses. So you just keep moving. I think that's one of our biggest problems when people say they couldn't help a person get pregnant, or fertility acupuncture doesn't work. Well, if the person's daimai is blocked and you don't know it and you keep tonifying the lower jiao, that's going to be a problem. So I just feel, put in needles, feel, put in needles. Sometimes I feel and touch a point to see if that point's going to help if I wanted to use fewer needles, but that's generally how I do it.
And how are you feeling on time? Are you okay? Because we still have a fair amount of questions to get through.
Yeah.
All right, you let me know if you're getting to a point where you want to slow down.
Okay.
So next question: patient with oily acne and a very red face. Do you have any suggestions?
Okay. Well, first of all, I don't know if they are doing anything to their skin, but the red face might be the result of, for example, Accutane or something. So they don't want to do that anymore. I think a warm oil cleansing can help someone like that, because they really, really do not want to dry their skin out trying to get rid of that oil. What they need to do is balance their skin. So lots of times I actually recommend that they do, put the oil on, warm water, rinse, gently take it off, kind of, and then there's still some moisture left in the skin. And I would be curious what their pulses are. Is that heat in their skin, or is the heat coming from some other organ system and showing itself up on the skin?
Very interesting. Let's see, next question. Please discuss cystic acne treatment in an adult ages 40 to 50.
Okay, so cystic acne, you can treat that internally with your acupuncture, and you can do some external treatment. I think there's a hormone component and an autoimmune component with cystic acne, because there's something going on in the body that's a little bit more complex than just your quote unquote regular acne. So I always look at the person's immune system. I always check out what happens. When does the outbreak happen? Did some stress happen? Did it happen with some sort of a food event? Usually I can find some sort, it's not just like, oh, it randomly happens and there it is. So I look at the person's immune system as well as kind of the heat component, and getting this, I would probably be needling their face as well to try to get their dermis to behave itself.
All right. Let's see. Do you have any suggestions for topicals for eczema?
Well, I have used the wakame for that because of the stem cells in it, because it, a topical product with stem cells in it and other active cosmeceuticals is made to go into the skin. So that's usually what I give my eczema patients. But again, they have to be judicious about it. They cannot be like, oh yeah, I'm just going to put this on right now, and then 3 days later they complain that it didn't help. They have to be judicious about it.
All right. I am curious about your approach to rosacea, both ocular and generally on the face.
Well, rosacea, first of all, I look at what the person is doing externally. Are they in the sun too much? Are they wearing their sunblock? Okay, so we have to make sure they're doing that. And then internally, again, I look at it as, I look at their digestion. I look at where it is. Sometimes it's only on certain parts of the face. So you get into your facial diagnosis, what organ systems are involved. I look at, does it happen only at certain times? I have needled it before. I had a rosacea patient that I did Mazen cosmetic acupuncture on years and years ago. And as I was putting the needles in, I said to myself, this is probably not going to work. This is probably going to make this worse. And it didn't, because again, you can reinvigorate the dermis. So I think with a lot of these skin conditions, don't be afraid to actually treat the skin. Okay, I think sometimes we move away from treating the skin because, oh, it's so red already, or there are broken capillaries in there, or the person is sensitive about it. I think we need to treat the dermis when there is a skin condition. The central nervous system of the skin is the dermis. So if you want to make changes in it, lots of times you actually have to treat it.
All righty. Do you have anything to say about moles, including raised moles?
Yeah, that's a dermatological thing. I mean, obviously, if you think it's irregular, then you got to refer them out. And yeah, I don't really treat them per se.
Okay, and then do you do bilateral or which points on left and right with your 4-point selection?
I do all bilateral, so 8 needles, 2, 4, 6, 8, yeah.
All righty. Any treatment recommendations for, I can't pronounce this, hypopigmentation following corticosteroids for eczema?
See, there you go with the corticosteroids, yeah. Remember I said in the presentation that sometimes it's going to lead to lines on the skin or too thin of skin. that is going to require rebuilding of the skin a little bit because the skin probably got so thin. And I have to tell you, hypopigmentation is one of the hardest things to treat. It depends on the age of the person. Our melanin cells start to decline in our 40s. So if it happens after our 40s, we're really having a little bit of a hard time because there's not even a lot of melanin in there. So younger people, I think you're going to have a better chance of getting that back, treating the whole body, the earth and the metal and the local skin. I think as people get older, it gets harder and harder to treat because of the lack of melanin.
Alrighty. Do you ever remove needles because the pulse is worsened rather than adding? I was under the impression that having more than 3 needles in the kidney meridian is not good.
Oh, my opinion is, and my master said this, it's what you're doing with the needles, not the number of needles. So I'll do like the navel. So there's 2 kidney points. Plus I've got a bunch of other kidney points in. So what was the first part of the question?
Do you ever remove needles because the pulse is worsened?
No, because I don't look at it as the pulse has worsened. Like, let's say I put some needles in and the liver suddenly is like boom, boom, boom up to the heart. Okay, I don't look at that as worse. I look at that as information for me. Those needles I just put in, what did they do? Like, why did that happen? Oh, is the heart blocked? And I didn't see it in the beginning and I need to open up the heart to let the liver through. So I don't look at it as worse. I look at it as, like, for example, and this happens in my pulse classes all the time, people are like, oh, look at that kidney. That kidney's really strong. And I'm like, no, I don't think so. Open the dime. And then the pulse feels like, it's gone. And I'll say, you didn't. They'll be like, oh, I just made the person's kidney really weak. No, you didn't. You just showed the true kidney pulse. This banging into the wall of the dime block, that's not a strong kidney pulse. It's a perverse kidney pulse. So I have had to say, it's okay, it's okay, it's okay. You didn't make the kidneys worse. All you did was show what's really going on in the kidneys. So I just don't say it's worse.
I just have to say, we have some really great questions. We get them every week, but especially really good tonight. So thank you to the audience. Next question, have you found a higher incidence of melanoma with patients post-COVID, especially in the cheeks, lung region, rather than just being hormonal related?
I have not, so I can't really speak to that. Sounds like an interesting hypothesis, though.
All right, we have just a few more questions here. Let's see, do you have anything to say about seborrheic keratosis? Seborrheic?
Seborrheic, yeah. In terms of treatment, I guess, I think it's looking at, I'm always going to look at the immune system with a skin issue. So I would look at that. What's the history of it? How chronic is it? Is it associated with any particular event or use of anything? And then I would move on from that aspect.
And I had a feeling that melanoma was a typo, and it was. It was actually supposed to be melasma.
Oh, I haven't. But that's even a more interesting hypothesis.
I was going to say it made a little bit more sense once I saw the follow-up about melasma, but I was
right.
All right, well, thank you, Petra. Sorry about that. So actually, I'm going to just combine 2 of these questions here because they can, I think, both be answered together. Can you suggest a topical for wrinkles, and do you have a preferred sunblock that you recommend?
Oh boy, now you're asking me. I make a sunblock and I make creams. So I created a natural skincare line with Chinese herbs in it. So that's tough for me to answer. Not really. We have a vitamin E sunscreen. It's my favorite sunscreen, partly because of what's in it and vitamin E and some knotweed. And then creams for wrinkles. I mean, moisturizing your skin can make wrinkles look better. I have not found a magical wrinkle cream that makes everything go away. Even our crow's foot serum has retinol in it. So, I'm taking the best of the old world and the best of the new world and putting them together for things. So, the best cream for wrinkles, I would use one of the Maizen skincare creams. Goji berry if your skin's too dry, and the pearl cream if you're younger and you like your skin to luminesce during the day.
Well, I think that we have gotten through pretty much all of the questions here. It has been such a great webinar. Thank you so much. Please just tell the audience who are still here, can you just tell them about a few of your upcoming classes that are happening?
Okay, well, yes, I have started to teach in person again. At lucasteachings.com, all of our courses are online, of course, since the pandemic happened. But I am starting to teach what I call little tiny private classes in Denver. I have a couple of Maizen cosmetic acupuncture courses coming up, April 24th and 25th, May 22nd and 23rd. In June, I'm teaching a special course on Saturday the 26th for Maizen practitioners who took the face and neck course but didn't take my abdominal course for weight loss and fertility. That's that day. And then I'm teaching my unique points course, like functions or combinations of points that maybe you never thought of before, on June 27th. And then in July, at the end of July, another Maizen course. So, and we are planning to do my big conference over in Turkey this year, the end of August and September. If you ever wanted to get CEUs in one of the most exotic places ever, I'm keeping my fingers crossed that we're going to be able to do that.
Well, thank you so much, Martha. There are links to these classes in the email that you're all going to get in about 5 minutes after we end tonight. And I also put them in the chat for anybody who's interested. Also, the Maizen skincare line is currently on sale for 15% off. That sale ends on the 20th, so definitely get the products while they're still in stock. I want to thank everyone for showing up tonight. Our next webinar is going to be on May 11th, and it's going to be Introduction to Divergent Channel Treatments for Joint Pain and Arthritic Conditions, featuring Lita Herman. We're very excited about that. Check out the LASA OMS blog to sign up for that webinar. You can also find any other past recordings and future events there. Thank you again, Martha. Thank you to everyone, and we hope you all have a great evening.
All right. Take care.
Thank you.
Bye.